We have a hit in our hands. Man, this Million Little Things premiered tonight right here. You just saw it. It's a brand new show. It gives us an inside look at a group of friends dealing with the shocking death, suicide of a friend.
And it is really, really disturbing because on average, there are about 123 suicides per day. So that's one death by suicide in the U.S. every 12 minutes. Now, the show hopes to bring attention to that disturbing trend. But for so many people, this is not just a television show. This is real life. WMER 2 News' Ashley James reports.
She would talk about just sort of the darkness descending on her, not being able to see any way out.
As a clinical psychologist and now special advisor to the President of Bayview, Dr. Dan Hale knows all too well depression does not discriminate.
She had begun struggling with depression as early as her teenage years.
His daughter Libby had gone through treatment before, but he says the depression always seemed to be lurking in the background.
I don't think that's a widely held notion that it is a medical problem. It shouldn't be viewed as, a personal failure or weakness. So I think often with her friends, her new friends, new acquaintances, she sort of felt like she should try to get by without treatment.
At the age of 36, Libby took her own life.
In the fall of 2012, she took some very powerful poison, which seriously damaged her lungs, but did not kill her immediately. So she was actually on a ventilator in an ICU for 4 months.
She died in January of 2013. Dr. Paul Nestet, assistant professor in the Department of Psychiatry and Behavioral Sciences at Johns Hopkins, says suicide has now jumped to the second leading cause of death among any American between the ages of 10 and 35 years old. And there are some demographics more at risk.
In general, around age 50 is the peak risk time, and then again after age 80, especially in white men. Interestingly enough, in African Americans, the highest risk age period is around age 20. But suicide is much more common in whites and in men.
And action.
ABC is taking the topic to the small screen when the season premiere of A Million Little Things airs. The show is about a group of friends motivated to live fuller lives after a friend unexpectedly commits suicide.
This is John. Perfect John. Maybe something else was going on. People keep secrets.
Dr. Nestet says 85% of suicide cases are due to a major depressive disorder, which can often come with red flags.
That's things like increased isolation in someone that you care about, or more hopelessness, or if you're looking for depression in yourself, pervasive feelings of sadness that last more than a few weeks.
He says it's all about treating the root of the problem, whether it's depression or substance abuse, and he stresses treatment has been proven to work.
Depression is an illness that we are really good at treating with medications, with psychotherapy like cognitive behavioral therapy. People that have attempted suicide that don't die, or that have had suicidal thoughts and don't attempt, rarely go on to die by suicide. Maybe 10%, less than 10% ever go on to die by suicide. So if you can not die, if you can get help, your chances of surviving are excellent.
As for Dr. Hale, he hopes sharing his story will help others going through a similar situation. But as for the pain a parent feels losing a child, that pain will never go away.
You never lose it, but to move from sort of grief toward gratitude, realizing that at least I had her for 36 years. She was a wonderful daughter.
There's been a lot of controversy surrounding shows that focus on suicide. One of the big ones was the Netflix hit series 13 Reasons Why. Dr. Nestet says studies show that right after that show premiered, there was a big bump in searches for how to kill yourself, especially around the target demographic for the show. He says the same goes for when a celebrity commits suicide. Jamie, Kelly?